have to wear shields in the lab anymore. We have to wear masks. We get to take the shields off this summer, so that's kind of exciting. Small
Hey,
things.
you got to celebrate the small things, right?
Yes.
Oh, that's good. But yeah, I mean, it would be hard. It'll almost be hard to imagine like not having masks on it in class and things like that.
I know.
We've been doing it for a while, but it probably won't take us very long to get used to it.
It'll just be nice to see faces again, and interpret facial, expressions too. I miss that.
Right. It's hard to remember names too when you can't see.
It is.
The whole face and yeah. Yep. And yeah, you just go by eyes and hairstyles. It doesn't help me much sometimes.
I don't like the fact that you can smile at people and they don't see you smile.
No. Yes.
Right. Yeah. So yeah, don't smiling with your eyes. It just doesn't really work so well. Some people, I swear, they do smile more with their eyes than other people. That's what I've noticed. Which is kind of funny. But yeah, I'm excited about a typical fall though.
Me too.
I don't know when that flip will switch, but it'll be quite a day, right?
Your background is really cute.
Oh, thanks. Yeah, it's kind
Love
of cartoonish, but yeah, I don't know. I downloaded this one last year sometime.
Oh, it's nice.
Yeah, we have one faculty member who always has like she kind of makes a point to just have really interesting backgrounds. Like if it's a holiday or she had like, when it was COVID, she had like these toilet paper backgrounds and then, just funny things that when did you see that cat? That whole thing, that attorney was a cat. She tried to get a cat, but she couldn't find one, but oh yeah.
Yeah, I'd be afraid it would stick. Yeah.
Yeah, right. But yeah, she's known for having those. It's kind of a lot of fun. So, but we'll get started here in just a couple minutes. I want to make sure we have everybody that will log on.
So with things hopefully slackening up a little bit, does anybody have fun summer trips planned? Other than Amy?
Yeah, I'm still like scared to tell people where I'm going. Anyways, but yeah, I'm going to Aruba this summer, but.
Oh, nice.
Nice.
Right. I was feeling really guilty about the whole COVID thing, but now I think people are traveling a little more, but.
Yeah, if you're vaccinated, it makes you feel better.
Yeah.
Right. So yeah. Any other people? Cool trips?
No, not really. Not anything big.
No, me either.
It just feels good to get out and feel a little normal again. So
yeah, for sure. Yeah. I know my husband gets his second vaccine, I think in about a week. So we feel like in about 3 weeks we're gonna like start going to restaurants.
Yeah.
So anyways, that's our plan.
Yeah, they said the vaccination clinics are the happiest places on earth right now. So
oh yeah.
People are so excited.
I know.
For sure.
I know, when I got my card, I told the gal, I said, this is my ticket to Aruba.
Yeah.
Anyway, so it's kind of funny, but anyway, so, well, I think we'll get started. It's 7:01. So I think we'll do some introductions first. And I'll just maybe start with myself. And then we can kind of go around and do introductions. I think what we'll do is just quick introductions and of the speakers and the students that are speaking from the USD and former USD. We're all kind of in limbo of USD Katie is, but so we'll do our introductions, and then each one of the programs is going to talk about the health profession briefly. And so we'll go in alphabetical order. So we'll have Avera go, and then Sanford, and then Southeast Tech. And then at the end, we'll have Katie, and I think, is Emma on today? I think she was, yep, she is. So they'll kind of just just speak a little bit about their college experience, and then we'll open it up for questions if any students have any questions for the students or for the members of the faculty members of the different schools. And so I am Amy Nelson. I'm program director of the undergraduate Bachelor's of Science in Health Sciences at USD. So if we want to, sometimes I have to point out people for introductions. So maybe we'll just go with Pam. Do you want to introduce yourself?
Sure. I'm Pam Boyd. I'm from Southeast Tech and technical college. I get not used to that yet. And I'm the program director for cardiac ultrasound.
And then I know we have Susan on, right?
Yeah. Yep. I'm Susan Kelmus. I'm the program director at Avera and School of Rad Tech.
And then we have Candace.
Yes, I'm Candace McNamara. I'm the program director for the Rad Tech program at Sanford Medical Center.
And our students are Katie.
Hi, I'm Katie. I'm a junior at USD, but also a first year student at Sanford X-ray program.
And we have Emma.
I'm Emma. I'm a senior health sciences major here at USD.
And then we have our program assistant, Amanda, the amazing Amanda.
Hi, I'm Amanda Huber. I've been with the program for 5 years, like something like that, 6 years.
Oh, yeah. And so I don't know if we want to, sometimes I know students like to remain anonymous, but if you want to introduce yourself, it looks like we have Brooke. Brooke, do you want to introduce yourself? If not, that's perfectly okay. And then we have Craig. And we also have Michelle Seaton Birch. Do you want to introduce yourself, Michelle? She maybe is just in the background here. I think that's about it. I hope I'm not missing anyone. So I think we'll start out with Avera, if you want to talk about your, 3 awesome things about the health profession and then also your program. So that would be awesome.
Sure. Yeah, so we've had a program at Avera McKinnon since 1947. Used to be students that come right out of high school, but now students need to graduate with a degree, and being a hospital-based program, we don't have any way to offer all of the prerequisite gen ed courses that you need. So students usually go to a university somewhere first and then come to our program. I would say, I always kind of tell our students when they come into our program, it's kind of like you're going to school and you have a job at the same time. The students spend 40 hours a week. A lot of what you learn is clinically and hands-on. So you'll spend about half your day in class, half your day in clinical. And I think sometimes when you think of radiology, you think of maybe just broken bones and chest x-rays, but the students do spend a lot of time in all of the different imaging areas like computed tomography, magnetic resonance imaging, interventional radiology, ER and trauma, diagnostic radiology, surgical radiography. They have limited rotations in some of the areas that really require an additional year of school after our program, like radiation therapy and ultrasound. So if you like the hands-on learning, it's good for that. You might be learning something in the classroom one day and applying it the next day. Gosh, I'm not sure what else we accept applications in September through January 15th, and then our start date is the day after Labor Day each year, and our students graduate 2 years later, the 3rd Friday in August. So we have scheduled vacations and days off throughout the 2 years that they're with us, but they do spend a full 2 years in our program. And I don't know if there's any questions, or Amy, did I cover everything that you kind of wanted me to talk about? Or
yeah, I think so. Sometimes I like speakers to say something kind of really cool about the profession. So do you have like one thing that's really cool that you think is like the coolest thing, I guess?
Yeah, I think the technology is changing so fast, and I always say it sounds so cliche, but it's such a high-tech, high-touch field. Most students, when I ask them, why do you come into radiologic technology? Well, they want to help people and they want to make a difference, but you certainly have to like technology and computers and really being on that cutting edge of technology. Our technology is changing just every year. There's new imaging out and fusion imaging. And I think in the next 5 to 10 years, it's going to be really interesting to see where we go. And I think that's another thing that's nice about our profession. We have all the different imaging areas. So when the students come into the program, they've decided on radiologic technology, but then we've got to sit down and try and help them find their passion. Like, what imaging area do you want to apply for a job in? Because there's so many opportunities there, and certainly can go on and teach or go into management or equipment sales, application specialist, where you go out and teach people and train people how to use the equipment. So there's just some awesome opportunities that way too.
That's cool. Yeah, thank you for mentioning those kind of unique ones that are related. So that's good. Thanks. So now we have Sanford. Sorry, I put your name together with where you're at.
So a lot of what Sue just mentioned is true for Sanford as well. We are a rad tech program. We have been around since the 1950s. We are accredited by the JRC, and we are a full-time 40-hour per week, 24-month program. We have articulation agreements with several universities, and USD being one of them. The students will take the first 2 years of pre-req classes. If they apply to our program and get in, and they finish the last 2 years, they do clinicals and coursework on campus, and then they would graduate from the university with a bachelor's degree. So we have very good success with the students coming in. And we do have some USD students right now. We are planning on having some of them into our program starting in July. Our program begins July of every year, and we graduate 2 years later at the end of June. I guess some of the things that I would find really interesting about radiology, as Sue said, the technology, it just changes constantly. You have a great opportunity for patient care experience. And when you come in, there are so many opportunities of where you can go. You never know when you start what you really are going to end up with. And from MR, CT, diagnostic, interventional, ultrasound, quality control, teaching, there's just so many different areas you can go. And we have very good luck, or a very good pass rate with the registry exam. Also, the job placement rate is exceptional right now. There are so many jobs out there.
So how many students do your programs take each year that apply?
We take 14 per year. So we would have 2 classes of 14.
Yep, and we accept 12 per year, and we adjust that as the market demands. If you know, a few years ago the market was so tight that we cut back on our enrollment, but right now we're accepting 12. We're accredited for a few more, but 12 just seems to be a good number, and for the clinical rotations we have in place. And
All right. So, and then we have Pam from Southeast Tech. And how many does Southeast Tech take, Pam, I guess?
We have 3 programs in ultrasound or sonography. We have a cardiac, which focuses on the heart, and then we have vascular that looks at the arteries and veins, everything except the heart, even transcranial vessels. And then we have DMS, diagnostic medical sonography, and that encompasses abdomen, thyroid, breast, OB, and reproductive organs. And the cap is 20 for the DMS program. Because people know more about scanning babies, they get the bulk of the applications because that's the ultrasound field people are familiar with. So they do have an interview process. For vascular ultrasound and cardiac ultrasound, we have a cap of 24, but we really haven't had to turn anybody away for quite a few years. So that's kind of nice. So other things about our program, the job demand is insane, and it has been for quite a while. The Bureau of Labor Statistics says sonographers in the United States make an average of $77,000 a year, and again, good job demand. We're pretty fortunate that we're accredited through the JRC, and we have a board pass rate of 100% as well. What I liked about the job, and I mean, I've been teaching for 20 years, but I still get to scan now and then downstairs. But what I like best about the job is that you're kind of the detective. You are the eyes and the ears of the physician. You kind of work on your own. You're kind of autonomous, and so you really become an expert in your area. You get to know the anatomy and all the possible pathologies that you might see. And if you do see one, you need to know what kind of tools to use to quantify the disease. Is it mild? Is it moderate, severe? Is it life-threatening? That happens sometimes for us too. But I kind of like being that detective. And sometimes you're the superhero, because sometimes you find the thing that the patient's been maybe coming in and off, coming in to see the physician a few times, and they really quite haven't put their finger on it. They order an ultrasound exam, and you find that. So that's what I always, I like that challenge. Everybody's a little different, so you're not just snapping a picture. You have to develop techniques, breathing techniques, patient positioning, tweaking your ultrasound system, which typically every 4 years we get a new one with new bells and whistles. There's always changes in the technology. So it's never rote, it's never boring. There's always new areas, like three-dimensional stuff is crazy, or strain imaging. It's a very sensitive tool right now for cardiac ultrasound, looking at the change in function, because some people have to be on chemotherapy agents that have a risk of heart failure. So this is a sensitive tool to monitor that heart and follow that patient along. And if there's any changes, then they would go on to a different chemo agent. So that's kind of exciting. So there's just always something new.
Yeah, sounds awesome. Did you want to share your screen with anything, or?
Well, if we have time, I can just pull up a couple images here.
Yeah, I think that would be fun.
Can you see my screen right now?
Yeah. Mm-hmm.
Okay, good. And I'll just go right up to the fun stuff. Well, this is cardiac ultrasound. If you know any anatomy, there's 4 chambers in the heart. So this is a view that typically people are familiar with. And again, we just look at the anatomy, the function. We look at the valves. We throw color on there. It tells us just with a quick glance if there's any stenosis, disease, regurgitation, any holes in the heart. This is a couple situations that I'm going to show you. This is a patient that has too much fluid around the heart. And the sonographer can employ some measurements to understand the hemodynamics of this situation. Is it at the point where there needs to be an intervention, where they need to put a needle in and draw out that fluid? And if that's the case, you may help the physician find the pocket which has the best approach, and then monitor the fluid being removed. This is a patient who's had a heart attack and affected the apex of their heart, which is not squeezing anymore, and a thrombus has developed there, a blood clot, which could embolize and cause a devastating stroke. And you can see actually there's a little mobile piece right here that would make everybody nervous. And then this is a patient that this looks bad, but this is actually pretty innocuous. This is a patient who has a benign myxoma. Tumor in their right atrium caused their legs to swell and their belly to swell for about 6 months. Somebody finally ordered an echo, and this was found. And 2 days later, the patient had this mass excised, and they're doing fine today. So it's just kind of the fun things like that I shouldn't say that's fun, but it's interesting, and it keeps us on our toes, and you feel like you're doing the patient a service. This is that strain echocardiography I was telling about. That's such a sensitive tool for to look at function and to monitor a patient who may be at risk of heart failure under certain types of medication. And this is just this 3D. This is a transesophageal probe that's down behind the heart, and we were able to see, this is a mitral valve here up in the upper right, and you can actually manipulate this image and look at it from the ventricle side and turn it around and look at it from the atrial side. The surgeon who wants to repair this valve may help him hatch a plan for surgical intervention. And then on the lower right, this is just a way we can evaluate leaky valves. This actually happens to be a leaky mitral valve. So getting just new technology all the time. I'll just end it there.
Okay, thank you. That was really cool. I enjoyed looking at those images. That's neat. So now we have Katie, if you want to tell us a little bit about what it's like to be a student at USD and then a student in a in the program that you're in, and maybe some advice for some high school students if they're interested in this type of a career path, or just advice for college in general.
Okay. So I started out at USD, and I'm currently a junior there. I'm not actually at USD right now, but I'm a junior, and I chose to do my articulation agreement in radiologic technology. And so I completed my first 2 years at USD, doing health sciences major or courses and everything. And then I applied to Sanford, and then I got accepted there. And then I started in July, in July of 2020, and I've been there since. I guess like I have found that the courses have really helped me and prepared me in the clinical and hospital setting, as well as in patient care. The X-ray program is, I mean, you get to do a lot of stuff. You're rotated into like a different clinical setting each week, and so that gives you very good hands-on experience and great opportunities. When you're completing like your health science courses in 2 years, essentially, it seems like a lot, but it goes super fast. But if you just stay focused and everything, it'll turn out well. And don't be afraid to ask your professors questions, because they may be your reference someday, and it gets them to know you very well, put a face to your name. And yeah, is there anything else you'd like me to say?
I think that's good, Katie. We'll see if they have questions at the end, but
Okay.
or I might think of some questions to throw at you too.
Yeah, that's fine.
They don't. And then we have Emma, who is just finishing up, right? You're finishing up your bachelor's degree. So do you have any advice for students in high school who are interested in health professions? You can just throw us your best advice now that you're on.
Yeah, so I chose the health science major just because there's a lot of different things you can do with it. I specifically am looking to go to PA school with my degree. I know a lot of people PT, OT, so there's a variety of things that you can do with the health science major. That's partly just why I chose it. And I also didn't really want so much of the science-based stuff. I didn't really want to be like a biology major just because I wanted to learn more of like the actual healthcare stuff, patient interaction, all that type of stuff. So I'm really glad with my decision to choose the health science major. And yeah, I will be done in about 3 weeks here. I think it's coming up pretty quick. So it does go really fast. It doesn't seem like I've been here for 4 years, but again, it's just kind of, you learn to keep up and just kind of adjust in that sense. But other than that, I would just say, don't be overwhelmed. A lot of people do end up changing their major. I actually transferred schools. I started at SDSU as a different major and then transferred here my sophomore year. And I'm still graduating in 4 years and everything. So again, just don't kind of be afraid to change in that sense.
Good advice. So I guess I will open it up. Students can ask questions in the chat if you want to, or, you know, just using audio. It's totally up to you if you want to ask some questions. Otherwise, I might come up with a couple of questions. I'll give the students a little bit of time here.
Amy, this is Michelle. Can I ask a question?
No, I'm just kidding. Of course you can. You probably have great questions.
I just want a clarification and make sure I have it right. Was it Sanford that said that they had 14 positions or spots every year? And
Yes.
was it okay? And then Avera had 12. Thank you. I wanted to just confirm as I talk to students. So I appreciate that.
Another difference too between Sanford and Avera and Southeast is Sanford and Avera, and correct me if I'm wrong, ladies, but they have to go to health university before applying to Sanford and Avera. Whereas Southeast, they can start there first or come to us, or they can start with USD and then go to Southeast.
Yeah, it's a forward or reverse
That's
articulation
correct.
with Southeast, yes.
Yeah, students that go to our program, the American Registry of Radiologic Technologists is the organization that administers the registry exam after the students are done, and they can't take the registry until they have their degree. So it would be really difficult to go to the Rad Tech program first and then take the rest of your courses to complete your curriculum for a bachelor's degree and then go take the registry, and it's been 2 years since you had your Rad Tech core courses. It'd be a long time. And then trying to remember all that for a 200 question registry exam would be kind of difficult. So yeah, they have to have all the curriculum done before they come to our program. And I think Candace does the same thing at Sanford. Everything's done. Yeah.
Okay, one more question. When your students go to take those registry exams, are they based off of, are they like a progression exam? So do they all always get 200 questions, or if they answer them correctly, are they done like at a earlier one, such as an RN exam? If they do well, a lot of times they get 75 and they're good.
Yeah, they actually get a score.
No, they have all of the,
Yeah, they
Mhm.
they take all 200 questions.
Okay.
And they get some pilot questions in there too, but they actually get a preliminary score. As soon as they take the test and then hit submit, they'll get a preliminary score up. So they know how they did. And then they get the content areas, they'll get a report back to on how they did in all the different content areas. So, and that's really helpful to us as program directors too, to help guide our curriculum and what do we need to maybe hit harder, or where are we really doing well. We have 100% pass rate on the registry too. And so they all do quite well on it, but it does give us some insight on, you know, are we, the technology is changing so fast. Sometimes the curriculum isn't even the books, and you're calling vendors to find out, you know, get information for some of your classes. So, you know, we keep up and make sure they're ready when the time comes. So.
And then do you do standardized testing throughout, like with a product to help them know
Yeah.
and how to take the test, take the exam, like practice exams?
Yeah, we review their last summer in the program, but then we also enroll them in a computerized testing program called Rad Review. And in that
Perfect.
program, there's 1,800 questions they can practice taking. So they are all in the second year students all enrolled in that throughout the second year. So just good
Wonderful.
practice. Yeah.
Yep. Because I know a lot of students have struggled with test taking anxiety, particularly on standardized national exams. And so I just was curious. Thank you.
I guess I'm curious if, you know, as far as like the job market, is it such that there's more jobs in like rural South Dakota, like the western part of the state, and or is it just everywhere? And then like I also have another question about, I know some programs or some careers, they have like tuition reimbursement they're in such dire need, or maybe like sign-on bonuses. Are those things that are offered now for these different professions? So I guess those are two questions that I have, and I don't know who wants to answer them, but.
well, at Sanford, our students will be graduating in June. And right now of the 14, we would have kept all of them right at the hospital in our
Wow.
department if they would choose to stay. But there are some that have family or spouses or others back home. So 3 of them will be leaving. Other than that, we've found that there are jobs available in rural areas, cities, a lot in Sioux Falls. We just can't hire them fast enough.
Yeah, I would say most of our students find jobs in hospitals versus like a clinic setting, but our students graduate in August and 4 of them have jobs. They've committed already, and several more have been interviewing. And so yeah, there's been quite a few jobs open all over. And like Candace said, a lot of them like to move closer to home, and you know, being in the Midwest, we're family oriented and we like to be close to family. So we certainly understand that. But, and there are sign-on bonuses. It kind of depends on which imaging area. Some of the imaging areas are really harder to fill, like interventional radiology is one of those that you train on the job. The students rotate through interventional throughout the 2 years, but then they really need some additional full-time experience in interventional to really start being a technologist in that area. It takes, you know, several months really to get really good at it. And those areas are offering $8,000 to $10,000 sign-on bonuses is not uncommon, because they're just really hard to fill positions. We've had a full-time neuroradiology position open for a few months, and there's a $10,000 sign-on bonus. So
I can speak to ultrasound. Our clinical internships are outside of Southeast Tech. They're the last 7 months of our program. And so we have them around the country. We have a few around here. And like I have a student in Boise, Idaho, and Harlingen, Texas, but I've got 4 students in Sioux Falls, a few in Minnesota. Typically for cardiac ultrasound, about 90% of the students get hired at their clinical site. But the last 2 years, I get phone calls all the time about job postings, and I put it on Facebook. I put it on our Southeast Tech website, but the job demand's been crazy. And sometimes they'll pay for moving expenses, and have been sign-on bonuses. I know Fargo's just really hungry for sonographers too. So job demand's good.
And what is the starting wage for typically any one of the tech positions? Is it around that 77,000 as you were stating?
You know, it kind of depends on the state. And unfortunately, I think Sioux Falls sometimes is almost the worst because of the school here. But I think students typically start out around $25 an hour here in Sioux Falls, but I've had students, you know, just even Minnesota, Wisconsin, starting out at $32 an hour. So, and, you know, that can be augmented with call and overtime as well.
And we do salary surveys 6 months after graduation, and it seems like the students that go to Minnesota are making $4 to $5 more an hour to a similar position here in Sioux Falls. But I always remind our students, make sure you're comparing apples and apples. We don't have any state income tax in South Dakota, and I really do think that makes a difference on pay when they're done.
Good point.
But we're like for a diagnostic radiographer right out of school, so not any of the special imaging areas. They're going to be, you know, in the low $20 and $20 to $22 an hour, probably, you know, in South Dakota. But that same position in Minnesota would probably be around $25 to $26 an hour.
So
a question I get, sorry,
ahead,
Amy, a question I get a lot of times is for each one of your programs, on average, what are the number of applicants that you get versus the number you accept?
At Sanford this year, we had 65 applicants for the 14 spots.
Yeah, at Avera, we had around 70, but I always remind people when they're applying that a lot of our students are applying to several different rad tech programs. So it's not like all 70 of those applicants need to come to our program or they don't have a place to go. Most of those 70 applicants are going to get accepted at one of the hospital programs they're applying to. But we average from but it just kind of depends on year to year, but anywhere from 50 to 70 applicants a year is a good ballpark.
Well, and at Southeast, I think I said this before, the DMS program, the abdominal OB program, since it's more well-known, they have more applicants than they have chairs for. So, and I think it's around 50 or 60. And so I don't really know what it is for vascular or cardiac because we haven't been full. But I know if you meet the requirements, you can get in. So I think sometimes we have applicants that don't meet the requirements, but for vascular and cardiac ultrasound, it's not hard to get in.
That's good. I was just going to kind of go back to the students again. I know to hear kind of the students' perspective, and I just thought I have to quiz my students more. So, I guess I was kind of wondering, like from a schedule perspective, especially for you, Katie, like, so when you were at USD, you kind of had this, like, it's kind of a freer schedule, right? In terms of like your classes. And then when you go to a technical program, kind of tell us the scheduling differences and then how, if that's challenging or not. And then I guess I'm kind of curious to know, like, kind of what you think the biggest challenges in college, or, you know, mostly about the schedule though.
Okay. So it is an adjustment because yes, in college you have your set times at your classes and then you can go do whatever you want or whatever. But in this program, we go from we are at the hospital from 7 to 3 every day, and that's a mixture of clinicals and class. And then some weeks you may have clinicals at night, so like from 1 to 9, but then you just come in at 1. But something I really like about it is you're always in routine. So like 1 week, your normal schedule is from 7 to 3 every day. And so you definitely get in routine, and it's more of your it's like a full-time job almost, but you're not getting paid, but it's like what your day would be like as a tech usually. And then you also get that more night experience because you work with different people, different things come into the hospital or whatnot. So but yeah, and you also do get experience on the weekends. So you'll have clinicals on the weekends sometimes, and overnights. You get to experience overnights. So that'll be fun. I haven't done that yet, but we'll see how that goes. But you also there are some job opportunities that you can also do after school, such as transporting. So I also do that. And so it makes your day a little longer, but it's good going along with it. So, and I really am enjoying this program. You get a lot of hands-on work, and there was a lot of things I also learned about radiology. Like everyone thinks it's just broken bones and taking a picture, but there's way more to it. You get to go up to surgery. IR is really cool. I had no clue what IR was coming in, but that's really neat. Get to help the doctors out a lot. Didn't know how close you get to work with the doctors sometimes. So yeah, it's really great.
Thanks, Katie. I appreciated you telling about the schedule because I know that is adjustment. I think for students heading to these programs and then even like graduate school, it's almost similar because like our clinical graduate programs, that is sometimes challenging for students just moving from the, kind of like where you have 4 different classes or 5 that you're taking that they meet 3 times a week, and then moving to a schedule that's really like where you're somewhere 8 or 10 hours a day. I know can be a little bit challenging, but thanks for that.
Yeah.
Does anybody have any more questions, I guess, for anyone, or any other comments? Thoughts that we didn't cover, I guess? Okay. Well, thank you for joining us, Brooke. Well, I guess if we don't have any more questions, I just want to thank all of you for telling us about your programs today, and the students. Thank you so much for giving the student perspective. I really enjoyed listening to that. I always love having our students on to kind of help pave the way. And if you have any other advice for incoming students, I think that really we just can't give them enough. Sometimes I think it's so helpful because it's been way too long for me to give them advice on what it's like to be a college student. So I appreciate that. And thank you so much to the programs to Sanford, Southeast Tech, and also Avera to telling us about your programs. That was super interesting and fun. And we will be sending this video to Brock from the HOSA. He's the head of the HOSA. And so he will be giving this video to others to share. So other students will be able to watch this recorded video. And we'll do a little bit of editing to the beginning. So, but thank you so much for joining us, and have a great evening, everyone.
You're welcome.
Bye
Thank you.
now.